மேம், இப்போது மென்ஸுக்கு வந்து பெரிய ப்ராப்ளம் பார்த்தீங்க அப்படின்னா ஹேர் லாஸ். அவங்களே நிறைய அட்வர்டைஸ்மெண்ட் பார்த்துட்டு அவங்களே ஆயிலெலாம் யூஸ் பண்ணிக்கிறாங்க. அப்புறம் ரிசல்ட் வராமல் போயிடுச்சு அப்படின்னு கவலைப்படுறாங்க. நெக்ஸ்ட் ஆப்ஷன் அதாவது ஃபைனலாக தான் ஹேர் டிரான்ஸ்பிளான்ட்டுக்கு வராங்க. ஸோ அது எந்த அளவுக்கு மேம் கரெக்டாக இருக்கும்?
First of all, if you have a family history of baldness, எப்படி தெரியும் உங்களுக்கு? Suppose உங்கள் father side or mother side, okay, they have the men in the family, they have a family history of receding hairline. அப்போ slower baldness, okay. Then you definitely know that at some point of time you are also high probability that you are going to have that. Okay. If there is no family history also, sometimes it can just start from you. Okay. Now, how to know that it is what kind of baldness? Pattern baldness will start typically with the receding side hairline, temple solvanga. So temporal hairline will start going back. Okay. Initial stage, there is a somewhat of denial that no, I cannot fall in this category. Okay. So that desperation is there and that fear is there. So whatever anybody says, use this, use that, your hair will grow back, they use it. But in the meantime, what happens? They lose a lot of time. Okay, it starts from grade 1 baldness, it will proceed to grade 2 baldness, grade 3. Till then, the acceptance will not come. Okay, many few people are there, initial stages, they will come and consult us. Okay. Most of the people will not. Okay, friends enna solranga, relatives enna solranga, adhu pandranga. I would say it is very important when you start that feeling that it is more than usual. The hair fall, normally illakku hair fall irukku. Okay. The hair is a living thing. It grows, it dies, it will fall. When it is more than usual that you are seeing thinness, density kammiya irukku, scalp visibility, when you have started to see this, then you should consult a doctor. Okay. Now there is so much of miscommunication. People will say you should not use minoxidil, you should not use this, there is side effect, this, that. When you go to Google also, there is so much of misinformation. Okay. FDA approved or any medically approved medicines for any kind of pattern loss are only 2 or 3. Minoxidil and Finasteride are the approved medication. Okay. Why they are approved and why the others are so many but they are not approved? Because approval does not happen just like that. It happens with a series of research and everything, and we see the mechanism of action and cycle of every drug. So when taken properly, after an advice from a doctor, and they will tell you how to stop, how to start, how to apply, then you will get the maximum benefit. So when you are in starting stage, grade 1, grade 2, you can reverse the grading by use of only medication. If you have wasted a lot of time and then you have come to minimal grades like middle grades, grade 3, grade 4, then it is advisable to take the medication or PRP, mesotherapy or even hair transplant to restore the hairline. Now hair transplant is like fill in the blanks. Wherever you have got a baldness patch, there we put the hair from the back to front and that's all. It does not treat your male pattern baldness, right? Even if you undergo hair transplant, you have to take medications. Okay, that you have to understand. There is no conflict about that. You have to save your other hair, which is your native hair, right? In the process, if you have gone to grade 6 and grade 7 of baldness, what happens? Then the hair follicle has completely died, lost the capacity to get stimulated by any medicine. Then you take medicine, you take PRP, you apply minoxidil, nothing will happen. Moreover, whatever is the leftover hair at the back, that is not sufficient to cover the entire area of baldness. Okay, that's why don't delay too much. Okay, if there is a pattern baldness, accept it, get treatment, get help. We can reverse in the initial stage. We can give you a head full of hair in middle stages. When you go to last stage, it becomes little difficult. But still, we try our best, but it is not as good as in the middle stages.
மேம், இப்போ நிறைய இடத்துல ஹேர் டிரான்ஸ்பிளான்ட் பண்ணுறாங்க. நம்மளோட ஹேர் பழைய மாதிரியே ரொம்ப நேச்சுரலாக இருக்குமா இல்லை ஆர்டிஃபிஷியலாக தெரியுமா மேம்?
I have seen both. Some people, the hairline looks very artificial. It is look like a straight line. Okay, that is now not how a good hair transplant is done. Signs of a good hair transplant: The hairline should be very, very natural. If you see the results of our patients, what we do in Tamira, nobody, if you go very near also and see, nobody can tell you that you have done a hair transplant. As natural should be the hairline, and it will look very natural. Second thing is, we are taking the hair from the back. So it should be taken properly. If you do over harvest, you will get bald spots at the back instead of front. Okay. So meticulous planning. How much of hair can we take? Okay. How much is the distance in between the two hairs taken? How they are implanted and how the hairline is designed. That is very, very important. That will give you equal to natural results that even you will not know that it is a hair transplant if you see properly.
மேம், ஹேர் டிரான்ஸ்பிளான்ட் அப்புறமா என்னோட டெய்லி ஒர்க் ரொட்டீன்ஸில் ஏதாவது ரெஸ்ட்ரிக்ஷன்ஸ் இருக்குமா?
Yes, restrictions are there. Initial stages like initial 1 month. Okay. So initial 15 days, yeah, it is a surgery. There are too many holes we put on the head to take the hair, to implant the hair. So infection chances are there. So we want you to keep the scalp clean. Why we tell you don't go in the sun, don't put helmet, because if you sweat a lot, okay, and that sweat sits over there, higher chances of bacterial contamination, higher chances of infection. So the restrictions are there only maximum up to a month. After that, if you are a person who wears helmet, if you are going for swimming, you want to use chlorine water, you want to play sports, do gym activities, you can do everything as normal. Once the transplant is complete, once the healing process is over, your hair behaves like a normal hair. Okay, so you can do all the activities how you were doing before, just after a period of 3 to 4 weeks, that is maximum a month.
மேம், அதே மாதிரி ஃபுட் டயட் பிளான் அப்படின்னு தனியாக இதுக்கு இருக்கா மேம்?
Good question, little different. Okay, I will explain you. For hair and skin, diet is very important. How it is important? Anything you eat, if you are not taking enough nutrition, if you are consuming too much of fizzy drinks, if you are having a lot of junk food, so the nutritional value of it, whatever you are eating, goes down. If you are not strong and healthy from inside, it will show on your skin, it will show on your hair. Okay, before a hair transplant or after hair transplant, it is same for everybody. If you want to keep your hair healthy, you have to make sure that you include green vegetables. You include seasonal fruits in your diet. Okay, one fistful of nuts in your diet. Okay, like 8 to 10 nuts, like healthy seeds like sunflower seeds and all the natural things. You don't have to go for hi-fi things to maintain your nutrition. Upon hair transplant, after the hair transplant also, same thing applies. Apart from nutrition, your lifestyle habit, like how many hours you sleep, how is your quality of sleep, the stress level, they impact a lot on your skin, on your hair also. Okay, even if you are taking all the medication, your nutrition level is good and all everything, the stress hormone level will directly impact your hair, and it will impact your hair growth, your hair fall will be increased and all. So that is very important. See, when we sleep, our body regenerates, it repairs itself. Okay, sleep, melatonin is secreted, that helps in the hair cycle. So adequate amount of sleep, good hydration, good nutrition, normal nutrition, don't take too much of oily food, include whatever I told, protein. These are the things which are important even before or after hair transplant. There is no specific diet you have to change after hair transplant, but you have to be a healthy person with a moderately healthy lifestyle. That should be just enough.
மேம், இப்போது லாஸ்ட் டவுட் மேம், லாங் டேர்ம் டிசீஸ் இருக்கிறவங்களுக்கு, சில பேருக்கு பார்த்தீங்க அப்படின்னா டயபெட்டிஸ் இருக்கும், பிபி இருக்கும், அப்படி இருக்கிறவங்களும் ஹேர் டிரான்ஸ்பிளான்ட் பண்ணிக்கலாமா?
Again, very good question. Hair transplant or any surgery, when there is any additional morbidity, any disease, any morbidity, the risk increases. Okay, now if you have BP, nowadays even in younger age people have BP, they have diabetes and all. If it is controlled enough, that you are on a medication, you are taking care of it and it is controlled, then you can go for hair transplant. A little bit of extra attention we have to pay as a doctor, that your diabetes should not shoot up, your levels are maintained. Okay, so there is some amount of additional risk. If your BP is uncontrolled, if your diabetes is uncontrolled, definitely like any other surgery, we will not advise you to go for hair transplant. Okay, it is same as any other surgery. You can undergo, the maximum age in which we have done hair transplant was a gentleman of 72 years of age. Okay, he did not have any kind of comorbidities. Okay? So we could do hair transplant. He wanted to restore his look, we did hair transplant. But it is best to do when you don't have any disease, and if you have also, you have to be in the regular levels. Everything should be maintained, then we can do hair transplant easily.